Welcome once again to our show and welcome to Issue Forum. I'm your host, Frank Avila, and our guest today is Victor Forys, or Dr. Victor Forys, MD, medical doctor, and he was a candidate for 5th District Congressman in the 5th District. He did not make it, but he made a very impressive showing, and he kind of shocked the establishment political community in Chicago because he beat out incumbent alderman Pat O'Connor for votes, and he won a couple areas in the city, including the 38th Ward, as I understand, as well as River Grove, and a couple other areas, if I'm not mistaken.
Well, Leiden Township, we did well in Leiden Township, and we did well in about 4 of the city wards, 190 precincts. So we had a good showing. We didn't beat Alderman O'Connor. We got like maybe 150 more votes, and really.
Well, you beat him in
clearly
the
winner was Mike Quigley.
Yes, no doubt. Commissioner Quigley, and we wish him the best. He's done some good things, especially on TIFs. I think Commissioner Quigley has done a lot of good stuff on tax increment financing districts in terms of wanting transparency. We just had a gentleman on before, Adam Ajewski. I think I'm saying the name right. And he believes in transparency, having things on the internet. As you spend something, it goes up on the internet. Every dime in real time, he says. Although that may be difficult, maybe you have to wait a day or a week to make sure you have everything on there. But I do believe in transparency, and Commissioner Quigley's been good to that. But you got more votes than Alderman O'Connor, and I think that a lot of people were underestimating you, and they did not view you as maybe as a credible candidate as the numbers bear out. Winning 90 precincts is very impressive. Winning whole wards or cities or townships is very impressive. But tell us a little bit why you wanted to run.
Well, that's the best question I always get. Why did I want to run? I've been a physician in Illinois for 25 years, and I've seen healthcare go from bad to worse to unbearable.
Okay, let me break in on that. When you say bad to worse, how has healthcare gone from bad to worse?
Well, when I started practicing medicine in 1973 at Ravenswood Hospital as an intern, a resident actually, in internal medicine, they brought in something called the DRGs, diagnostic-related groups, and this was in an effort to contain costs. The Reagan administration brought these in. They closed 10,000 hospitals across the United States, and hospitals were paid not on the basis of what services they provided, but rather on the basis of what the diagnosis was. So hospitals, in an effort to stay afloat, were discharging people, and I'll never forget, we had a gentleman who was living next door to us. He was 90 years old or older, and he went to the hospital and he had a prostate surgery, and they sent him home in an ambulance, and they put him into bed, and the poor man lived alone. There was no follow-up, and my dad called me and he said, you know, this gentleman is sick, and so we had to take him back to hospital. So that was the DRGs. That was the first salvo of cost saving. And obviously
I have heard some horror stories. One insurance company comes to mind, and I'll make sure I'm not defaming them, and if anybody's fair, it can come on, but Unicare, I believe it was, and that they people wanted to go in for an emergency room operation. I've seen some things on TV. I've read about some things. I don't have the personal knowledge, so I want to make sure I'm not defaming a particular insurance company, and that they didn't approve it. The hospital, I guess, didn't accept it, or they didn't go because they wanted to pay for it. Because I guess you could theoretically go to any emergency room. I heard University of Chicago now has some exceptions where they're not permitting people or transferring people, although they're claiming that's not the story, and that they couldn't get in, their insurance company wouldn't do it, and some people actually died because this insurance company would not approve or pre-approve the procedure. Have you heard of these type of situations also?
No.
No?
No, I mean, if you need emergent surgery, you present to any emergency room, and
well, I guess it wouldn't have been emergency, but it was a critical situation, maybe not one that everybody would go to the emergency room for. It was not pre-approved. That person stayed home, and they died.
Okay. Well, we see that a lot, yes, but not so much in people who are insured, but more so in people who are uninsured, and that situation occurs too often. We just had a patient in our clinic a few months ago, a gentleman who didn't have insurance, but he worked. He worked as a truck driver, bus driver. He had an 11-year-old son. He was divorced. He tried to, work to pay his bills, to pay the alimony or the child support. And he was driving his truck through the Rocky Mountains and went into a snowstorm, had to put the chains on the tires, and developed chest pain. So he drove with chest pain on and off back to Chicago, got back to Chicago. He was walking around for a couple days with chest pain, and he came to our clinic and he was just writhing in pain. He was rocking in his chair, and by the time, you know, he was seen, which isn't a long time, he wasn't sitting there for a very long time because other patients observed he was writhing in pain, and he was brought into the examining room. He didn't have any blood pressure. So the ambulance came. We're only 3 minutes away. The ambulance is great, and they took him to the hospital, and they did some emergency intervention. But 9 days later, when he was to be transferred to Christ Hospital for a heart transplant, you know, he died before he could be transferred. So we see that a lot. We see people delaying care with abdominal pain, with chest pain, with all kinds of pain, or even with an abnormal EKG, where you probably, you know, geez, you know, you have your heart is overgrown, and the patient says, look, I really don't want to go into this. I just want to have my hernia repaired, and I don't care about my heart because I don't have any insurance, and I don't want to deal with that right now. So that's what we see.
Now, some people of a more free market economic perspective may say that, well, somebody has to pay for it. And I know some people on the Republican side of the aisle are saying, well, somebody has to pay for it. So isn't that a truism that if you have an operation that costs X amount of dollars, that somebody's going to have to pay for it, and either that's going to be paid by the individual or his insurance or by taxpayers, or it's going to be write-off or money that is owed to the hospital?
Well, there's no such thing as a free lunch, I guess is what they're saying. But
well, isn't that true, though?
Of course. Okay. Everything that's done has to be paid for. The problem is that our health care system, because we really don't have a healthcare system, we have just a group of special interest groups who are tugging at that 16% of GDP. We pay 16% of GDP for what we're getting. Other industrialized countries pay about 10% or less. Japan 8%, and they live longer, they insure all their people. So we're not getting value for money. So we just have the most expensive healthcare. We have good health care, you know, like if you're in a center that specializes in something. For instance, Senator Kennedy's being treated with gamma radiation, and there are great centers in Chicago, University of Chicago you mentioned, and other great teaching institutions where you can get high-quality, cutting-edge care. But that doesn't help the 49 million people who don't have insurance, and it doesn't help the people who are underinsured or people who have just lost their jobs and don't have the money to pay for COBRA.
Now, for those 49 million people, some on the Republican or some conservative or some maybe libertarian or individualistic philosophies would say, especially a lot of libertarians like Ayn Rand, would say, okay, well, that's these people's fault, that there has to be some kind of personal initiative, self-responsibility, that they should either buy insurance, there is insurance that can be gotten, and that they just don't want to pay, that they're not taking the self-initiative and responsibility to pay for that insurance.
Well, I look at it from the other end. I look at it from the end that we pay too much for our health care. And I think that's clear. We pay too much for our health care, and we need to bring down the cost of health care. We don't need to go out and insure another 50 million people and bring that 16% of GDP to 20% of GDP. What we need to do is take that 16% of GDP and cut it back down to 14 or 12% of GDP. That would be a great, great advantage, and that's why I wanted to go to Congress, in order to be there during the debates about how health care is going to be resolved, and what type of programs and what type of institutions will be created, or what type of insurance plans will be available. And we had a forward-looking plan that's on the website, and that's why I wanted to go there, to push that agenda. And I think as a primary care physician, where I deal with all aspects of medicine, whether they be in the office or at the hospital, in the community, or the tertiary hospital where they do the heart surgeries, or nursing home, home care, long-term care, all those things. We're involved in all of that. And the business side of medicine, because I own my own clinic, so I'm a physician manager. So I have to pay the bills, I have to pay payroll, I have to insure my employees, I have to make sure that the roof doesn't leak, that there's enough heat, that we air condition the place, that that the phones ring. So I see things from every side, and what I see is that the part of medicine that is the most efficient, which is the small business side, physicians like myself or people in private practice, we're the most efficient entity, but we're the most overregulated. Whereas insurance companies, drug companies, device manufacturers, hospitals, although they'll say that they're tremendously overregulated, are actually unregulated when it comes to the business of medicine. So what we need to do is we need to regulate those people that are spending the money and not spending it wisely, and we need to deregulate small business so that small business can then compete with hospitals and other institutions so that we can bring these prices down to competition and free markets.
Okay, now you had mentioned that Japan spends less. I think you said 8% of their GDP, but has actually longer life. That goes to 2 points that I want to ask you about. One is that it seems that even though we have longer lives now than maybe previous generations in America, and there's so many brilliant things like washing your hands and public sanitation, and people live longer, and vaccinations and the like, that we have higher rates than before or anywhere else in the industrial world of cancer and heart disease. So how much of it is lifestyle prevention? For example, in Japan, if they have exercise in the workplace or they have a high fish diet, so they have omega-3, how much is that? And the second thing is, it seems like billions of dollars, I don't know what the figure is, goes to alternative care, and many people in alternative care, whether it be under a regular medical doctor, but they go to a chiropractor or an acupuncturist, or they get massage therapy or whatever therapy it is or isn't, that some people are getting benefit and they're walking with their dollars away from traditional medical therapy.
Well, those people who are going to herbalists or acupuncturists or massage, they're paying out of their own pocket usually. Usually that's not covered by...
Right. Well, some Blue Cross Blue Shield does cover chiropractic up to a certain point, and acupuncture, because I have Blue Cross Blue Shield, and I spend for my wife and myself, because I have my own business, and my son, for my wife, my son, and me, I spend...
$800 a month.
Well, yeah, a little over that, about $900 a month. I pay, and then I have a secondary insurance because I'm an Army reservist with TRICARE, and a dental insurance with TRICARE. So through my medical insurances and my dental insurance, I spend about $15,000 a year.
That's a lot of money.
Yeah, and the only reason I don't get rid of Blue Cross Blue Shield is that if I were to get out of the Army, then because I had the pituitary adenoma, I had a brain tumor, I could be disqualified from being in Blue Cross Blue Shield. So that's why I keep the Blue Cross Blue Shield policy, even though I have a much less expensive policy as an Army reservist.
Because of the pre-existing condition.
Right. So then I get rid of Blue Cross Blue Shield. Once I'm disenrolled from the Army, I now lose the Army insurance, and now I can't get insurance. I'm uninsurable.
Well, our system is not a system. It's just fragmented, and it doesn't work, and we have all of these things and rules and pre-existing conditions, and people like you suffer, and excuse me, a little bit of a post-election cold. And people like you suffer, and other people in your situation suffer because they can't get insurance, or they have to pay very high rates, or they can't afford insurance. And whether you're employed, whether you're unemployed, you still need health care. And the models of health care in other industrialized countries decouple employment to health care. And that's what we have to do in this country, and we have to simplify the health care system. We have to make sure that people, if they like the insurance they have, they can keep it. But to give them some type of alternative where they can go into a system, into a government-regulated system, because the insurance companies cannot police themselves. I'll give you one example. United Healthcare had a president, one of the largest insurance companies in the United States, United Healthcare. The CEO took $120 million in bonus as a result of stock options that he had purchased. Now, or had been given as part of his pay. It wasn't enough that he was going to get, you know, hundreds or tens of thousands of dollars. They had to backdate those stock options for him so that he would get even more which was against the law. Did he go to jail? No. So you see, it's so, I don't like the word corrupt, but it's so fragmented, and the medical industrial complex is really a group of special interests that, although they're separate from each other, they're overcharging the American people. We're not getting money for value. We need to get money for value, and then we can start insuring all our people. We have to first save money before we can spend money.
Okay. Now, do you think a good model could be like how the U.S. military uses the TRICARE system? Could that be a model for the general public?
I don't think so. You know, the military uses, you know, Champus insurance is something that, you know, they use private health care to do that. What we need is insurance reform. We need to change the way we develop drugs and medical devices. We need to have controls on hospitals. I'll just give you an example. There are hospitals in this city where people are, you know, lying in gurneys and emergency rooms, and you walk down the corridor and you can hear people who are screaming and obviously in distress from, say, nursing homes or wherever. They're screaming because they're ill, and usually psychiatrically ill with Alzheimer's or something of that nature. But it's audible to the entire ward, all the people on the ward hear that. Or you can go to hospitals where it's nice and quiet. Every room is a private room. There's a waterfall down the wall. And you know, why is that? Well, it's because the disparities in reimbursement between these two hospitals, because even though this hospital treats a sicker population than this hospital gets more money because they have private insurers who are paying the bulk of the care for that, and this hospital is depending on Medicaid and Medicare, and that's where you have the discrepancies.
Now let's switch away from the medical topic, understanding that's the reason you ran and that's your background. You were a medical doctor. That's what you were trained by your education, and that's been your profession for a number of years now. I heard you talk at one event, and you were talking about your involvement with Solidarity at the time of Lech Walesa, and probably, I'm assuming, the late 70s, early 80s. And it sounded like a very exciting time, and it sounded like you did some really great things. Tell us a little bit about your experience with that.
Well, I was a witness to history, participated a little, and I went to medical school in 1977, in the fall of 1977, to Gdańsk, Poland. And in 1980, they had the Solidarity movement, which came up and changed the country. You know, just completely changed the country, changed the continent, changed the world. It didn't happen all at once. They were defeated. Martial law was imposed, but they didn't back off. They didn't back down. And finally, in 1991, Poland had elections. They did it in a very civil way. There was no one shot. This was not an upheaval. This was, you know, when it finally came down, there were no riots, there were no people arrested. It just changed from communism into a democratic society, and it sent ripples throughout the entire socialist camp, or entire, you know, all the way, you know, the East Germans and
Lithuania, Estonia,
all the countries, even Soviet Union, you know, affected the Soviet Union. You know, that was part of the reason the Soviet Union broke up. Well, I don't think it was that Poland caused the Soviet Union to break up. It's just that the same dynamics that were going on in all of these countries at the same time, the Poles just started it first.
Well, the Poles may have been the first domino that kind of hit down all the other dominoes.
Well, it's not a domino. It's just sort of like you could say that these were all open gas cans. All of these countries were just waiting to ignite, and someone had to light the fire. So the guy that lit the fire was Lech Walesa and the people who rallied behind him. Now, had there not been a Lech Walesa, had there not been a Solidarity, the world would probably be much different today. Maybe that change would be coming now. Maybe we'd still have a Soviet Union and an Iron Curtain. Who knows? But the fact of the matter is that it was a great experience being there and seeing that movement, you know, that grassroots movement. You know, people talk about grassroots and grassroots movements, And this was truly a grassroots movement. There was no access to TV for solidarity. There was no access to radio. There was no access to print. You know, we were printing, silkscreen printing and handing out leaflets, and it was truly a grassroots movement.
Now, what did you learn by running for Congress? You didn't make it. You're not the congressman, or you're not the Democratic nominee. There's no congressman yet. But what did you learn by running for Congress?
Well, I was very humbled by the experience. I realized that the candidate is the person that's put out there by the campaign, but you know, you're so reliant on everyone in the campaign, from the volunteers to the people who contribute to your staff, and especially to the voters. You know, I'm just very grateful that people voted for me. We ran to win. We didn't win. We're happy we did we didn't embarrass. I didn't embarrass myself, thank God. So I'm just grateful for the experience, and I learned that there are things that are important in life and things that aren't. And public service is something that's very important in life. I think it is. And it didn't work out for me right now for me to go to Congress and to serve the public. But I think we elected a very good person to represent our party. And, Mr. Quigley is, a great candidate, and I support him. And we'll do everything to get him elected and hopefully work with him. You know, if I can't go, then at least maybe I can email him stuff and have some effect on the process.
Now, one focus of your campaign, it seemed, as well as in the post-analysis selection of why your results, your numbers were so good, was that there was a small but growing Polish political consciousness. That even though the 5th District has a high percentage of Polish, as does the city of Chicago, I always hear the phrase that the city of Chicago is the largest Polish city outside Warsaw. But that when I was a boy, you had a Bogelski or Puczynski or other names that I can remember, Rosenkowski,
Lechowicz,
among others, is that you don't see a lot of names now, at least on the Northwest side. You still have Alderman Zalewski.
I don't think he's alderman anymore.
Alderman Zalewski on the 23rd Ward on the south side, I believe, is.
Okay.
Okay. Matlack was, I guess, Polish or part Polish. He's no longer there. You have some in the smaller towns. I know you're supporting Mark Dubiecki for Harwood Heights.
Right, he's running for mayor, and
there's
Andy
another
Przybilla
Polish
is running in Niles.
Andy Przybilla, I've known for a long time. The White Eagle,
right?
The White Eagle, very famous. So you do have some in the suburban areas where it's heavily Polish against Mark.
Mayor of Justice, Mr. Wąsik.
Okay, so it's not like they're completely absent, but in terms of congressmen, state reps, senators, as when I was growing up and you saw a slew of Polish names, that even though the Polish population has actually increased, it hasn't decreased, that you have a decrease in Polish or Polish-American representation.
Right. Well, we are one of the most, if you take Polish Americans as a group, we're very much underrepresented because we're about 10 million people in the United States, which represents 3% of the population, and we have 0.6% of the representation in Congress. And although people don't identify Polish people as a minority group, certainly not, because we're not discriminated against in any way, we blend in. But we are an ethnic group, and we have less representation than, say, the Irish.
Okay. And you're a much larger population.
No, we're smaller than the Irish.
But not in Chicago.
I don't know, but I think
nationwide certainly, but not in the city of Chicago.
Well, there is a substantial population of Polish people in Chicago, and a lot of it is concentrated in the 5th Congressional District. There's about 117,000 people of Polish ethnicity, according to the census, in that district, or there was 10.
Well, what did you do to kind of awaken this vote? Because the Board of Elections, there was reports that usually maybe the Spanish vote line is the highest. In this election, surprisingly to everybody, it was the Polish kind of voter line. And there were stories, I don't know if they were mythological or apocryphal, but that people would come in and they didn't ask for a Democratic or a Republican ballot, they asked for the Forys ballot. And that a lot of early voting, that there was a lot of early voting of Polish people, Polish Americans. Of course, they're U.S. citizens, they're voters. So I don't want to tribalize Chicago or America too much, but that is a reality of ethnicity is that you seem to have done a real big job on early voting, and that in terms of your get out to vote, you had your people get out to vote, and they were utilizing the resources to make sure they were voting correctly.
Well, we did a lot of Polish media, and we did a lot of voter education, and the Polish population in Chicago and in Illinois, well, mostly in Chicago and, say, the collar suburbs. The people further down south in Illinois have been here for generations, so they're plugged into the political system more than, say, recent immigrants that came during the Solidarity phase. Those folks are a sleeping giant, you know, just like the Mexican vote. You know, the Mexican vote is another sleeping giant, and we ran very well with Mexican voters. We had Mexican volunteers and Spanish-speaking volunteers in general, and we did very well. And there's a lot of Mexican people living in close proximity to Polish people, and they'd see the signs, they'd ask their neighbors, and they're both Catholic. There's a lot of intermarriage. So that together, the Polish population and the Mexican population of the 5th Congressional District is about 40%. Now, we didn't make enough inroads into that. You know, we would have liked to make more inroads. But I think if someone were to run a campaign and mobilize that vote, that would be a very formidable combination.
And we should work on that, you and I, Dr. Forys. But we only have about a minute left. I'd like to talk about what you plan on doing for the future. I know you still have a website up and you still have some contact information up. What are you planning on doing for the future? And if any of our viewing audience is watching, how can they contact you?
Well, right now I plan to practice medicine, go back to practicing medicine.
And you do internal medicine. You have a clinic in Jefferson Park, as I understand.
Right. It's a multi-specialty clinic and family primary care and specialty care with physical therapy. And we do a lot of work with people who have had accidents, whether it be on the job, car accidents, or at home or whatever. And I'm going to try to spend more time with my wife. I haven't been spending a lot of time with my wife. You're taking me away from her. I hope she's not too upset today.
You can bring her by the show.
I think I will, but she's not that
politics
big
can do
into
that.
politics.
Yes.
We'll try to get her more involved, but she's a wonderful person, and I'd like to spend more time.
But you are going to stay involved politically, from what I understand?
Yes, I've always been involved politically.
Okay.
This is not my first political...
And what's your website?
VictorForUs.com.
VictorForUs.com. Dr. Victor Forys, thank you for being on our show. To our viewing audience, thank you for watching. Goodbye. God bless.